Hi, welcome to Checking In with Amy. My name is Amy Goldberg and I'm a registered nurse with Neighborhood PACE. PACE stands for Program of All-Inclusive Care for the Elderly, that being 55 years of age and older. And the goal of Neighborhood PACE is to keep having you live in your home that you love in a safe manner and out of a nursing home. We service the areas of East Boston, Chelsea, Revere, Winthrop, and Everett, Malden, Medford, Melrose, Stoneham, and Boston's North End. Today our subject is everything that you want to know about gout, an interesting topic. And my guest is Angela Kim, who is going to graduate in May with her Doctor of Pharmacy in 2020. So welcome, Angela.
Thank you so much for inviting me.
My pleasure, honey. So let's just start right out.
Sure.
So let's talk about what exactly is gout.
So gout is a disease that occurs in the response to the presence of crystals that are made out of uric acid in the joints, bones, and soft tissues. It can result in 3 different kinds of arthritis: acute arthritis, also known as gout flares, chronic arthritis, and tophi. Now, tophi is just a fancy word describing the buildup of solid uric acid in the joints over a very long period of time.
It looks like a big bump.
Yes, yeah, it does. It's usually not painful, and it's very rare due to the medications that we have today. Tophaceous gout is typically removed by surgery.
And so what exactly is uric acid? You mentioned that.
Uric acid is a natural substance in the body that appears when your body is breaking down waste. When your body breaks down something called purines, which are naturally found in food, uric acid is made as a byproduct.
And tell me now, so we know what uric acid is, and we know what gout is. It all doesn't sound great, but it's okay. So how would someone be able to diagnose this disease?
Sure. So providers will usually do a blood test as well as a urine test to measure the amount of uric acid in the body. Some providers may do an x-ray or remove some of the fluid from the joints just to see what the uric acid crystals look like. Now, in order to be diagnosed with gout, you need to have high uric acid levels, crystal formation in the joints or tissues, as well as inflammation from those tissues. Just because you have a high uric acid doesn't necessarily mean that you have gout. Plenty of patients have high uric acid levels but don't have the gout or the crystal formation.
Okay, so that's good. So you can have uric acid crystals. Doesn't necessarily mean that you have the diagnosis of gout.
Right.
So you put together a slide that I thought was kind of interesting, and you were liking gout to pasta.
Yes.
So everybody knows about pasta anyway. So let's talk a little bit about that.
Sure. So gout can be compared to cooking and draining pasta. If you cook a lot of pasta noodles and you let them sit, it can clump together and be really hard to separate. Some patients just have naturally higher levels of uric acid, and the uric acid can clump together. Now, if you cook a lot of pasta noodles, then a strainer can help you separate the water from the pasta noodles. Some noodles may fall through the holes, but the majority of it stays in the drainer. Uric acid can be harder to clear in some patients with poor kidney function, so it would be like using a strainer with extremely small holes or even using a bowl to drain your pasta.
Okay, so I can visualize that. Yeah, it's not too bad.
Yeah.
So some people get gout, some people don't. So let's talk a little bit now about what the risk factors are for people to get gout.
Sure. So gout is higher in elderly men, and it's also more common in Pacific Islanders. Some differences in genes have been linked to an increased risk of gout. Obesity has also been linked to gout. Interestingly enough, research has shown that as the rate of obesity increased over the past decade or so, so has the rate of gout.
It's a shame.
Yeah. Alcohol consumption, especially beer and spirits, as well as high consumption of sodas and fruit juices with high amounts of fructose or regular sugar can also cause gout. Patients with chronic kidney disease are at a higher risk of gout because the uric acid isn't able to leave their body as well. High blood pressure, organ transplant recipients, as well as postmenopausal women are at an increased risk for developing gout.
People have to watch their diet.
Yeah, they do.
Don't you think?
Yeah.
This is like, it just keeps going on and on. So I've seen patients with gout flares. So let's talk a little bit about the next slide, which is kind of a picture of a gout flare?
Sure. So gout flares are a short-term and quick worsening of gout symptoms. It typically involves one joint that is intensely inflamed and is usually a joint in the lower extremity. About 80% of the first few gout flares involve one joint in the lower extremity, with the big toe or knee being the most common joint involved. Patients who have had gout for a while can have gout flares in more than one joint and in different areas of the body. During a gout flare, patients usually have severe pain, redness, swelling, and are unable to use the joints. Swelling and pain reach a maximum within 12 to 24 hours from when the gout flare starts. Gout flares tend to start more at night, and inflammation can spread to areas around the joint that is involved. If untreated, gout flares can last from a couple days to a few weeks.
So if someone had, like, get up in the morning and there's their foot like that, that's like extremely concerning, what should they do?
If patients start experiencing gout symptoms, they should call their doctors immediately.
I would think so. I
Yeah.
mean, that would, how would you
Looks
even put a shoe
painful.
on?
Yeah,
you know?
yeah.
It looks kind of sore. So there must be reasons that these gout flares happen. So let's talk now about what some of the possible causes are that can cause these very painful looking gout flares.
So genetics, again, plays a pretty key role in the cause of gout flares. Certain characteristics, such as the shape or the size of the uric acid crystals, can also cause gout flares. Injuring the areas where the gout flare appears will also cause gout. After surgery, patients are typically more swollen, which can also contribute to gout.
Right.
Starvation, consumption of fatty foods and alcohol, as well as dehydration, can all contribute to the cause of gout. Unfortunately, existing changes in the joints from osteoarthritis can also cause gout because the changes can make it easier for the crystals to get lodged into those joints. Certain medications can also cause gout flares.
I have osteoarthritis, so I know.
Yeah.
Don't want to get gout. Certain meds. So now let's talk about, so it's unusual. So now we've got medicines that can actually cause gout flares. So being a doctor of pharmacy, all these meds have to be kind of balanced,
Yeah.
I would think. So what medications can cause gout flares?
So some medications that can cause gout flares are loop or thiazide diuretics, which are also known as water pills. Aspirin has also been shown to increase the risk of gout flares. Allopurinol and probenecid are both medications used to lower the amount of uric acid in the body, but can also cause gout flares. It seems ironic that these medications can cause gout flares because they lower the amount of uric acid in the body, but actually at first they can cause the amount of uric acid in the body to increase. Losartan for blood pressure and fenofibrate to lower cholesterol can also cause gout because they both have mild effects on lowering uric acid levels.
Okay, so we get this allopurinol that can go both ways.
Yeah.
So let's talk a little bit now about medications used to treat and also to prevent gout and gout flares.
The medications that are used to treat gout flares are nonsteroidal anti-inflammatory drugs, also known as NSAIDs, such as naproxen or indomethacin, prednisone, and colchicine. NSAIDs are used to relieve the pain that is associated with gout flares. Providers will typically choose naproxen over indomethacin because indomethacin is a stronger NSAID and is associated with more side effects. Prednisone is a corticosteroid. It's used for 7 to 10 days, and then the dose is steadily increased over a couple of days. It's typically used when NSAIDs can't be used in a patient, such as if the patient has had an ulcer in the past or has poor kidney function. Prednisone can increase blood sugar, so diabetic patients should monitor their blood sugars frequently. Colchicine is a very commonly used drug for gout. It used to be given until patients experience diarrhea, but research has shown that dosing until patients experience diarrhea did not decrease the gout flares. Prescribers will give 2 pills for the first dose and then 1 pill 1 hour later. After this initial dosing, it can be taken once or twice daily until the attack resolves. Very common side effects of colchicine are diarrhea, vomiting, and nausea, and should be reported to doctors if patients start to experience these side effects. A medication that is very commonly used to prevent gout flares is allopurinol.
Here we go with the allopurinol. So it can cause it, it can treat it. I want to
Yeah.
know. I'm not like feeling good about this. So the allopurinol, let's talk about some facts about that.
Sure. So allopurinol, like I said, is a medication that decreases the amount of uric acid in the body.
Right.
It's usually not used during gout flares, and it's started about 3 weeks after the gout flare resolves. Although patients can experience more gout flares during the first couple of months of taking these two medications, the symptoms can be managed with pain medications and should still be taken in order to prevent future gout flares. It's usually taken once a day, but can be taken 2 or 3 times daily if the patient's dose is higher. It's taken after meals with plenty of water to prevent side effects. Allopurinol is typically a safe drug, with the most common side effects happening in about 1% of patients.
That's really low.
Yeah, it is. And the most common side effects are gout, nausea, vomiting, and skin rash. Allopurinol should be taken carefully, especially if a patient is taking warfarin, which is a
Right.
blood thinner, or antacids. Allopurinol can actually increase the amount of warfarin in your body, so it's important that patients who are taking warfarin and allopurinol together monitor for signs of bleeding, such as bruising or bleeding from the gums. It is possible for antacids to decrease the level of allopurinol, which is why it's so important for your doctor and pharmacist to know all the medications you are taking, even things you buy over the counter yourself.
I know. And I've always told my family and friends that they should keep a little card with all their medicines, all the diagnoses and everything, and how often, even if it's over the counter, because when they see the doctor or the pharmacist, they should have that
Right, it's so
complete
helpful.
list. It's like so important.
Right.
So this is all about the gout, how to treat it, what meds, but now I want to talk about lifestyle changes,
Sure.
because I think along with medicines, we have to be aware of our body, and we want to decrease the risk for gout flares. So what kind of lifestyle changes could we do?
Sure, there are a couple things that we can do at home to prevent gout flares. Weight loss or maintaining a BMI of less than 25 can decrease the risk of gout flares. Increasing the consumption of low-fat dairy and reducing meat and seafood consumption can decrease the chance of getting gout. Decreasing the amount of alcohol as well as avoiding sugar-sweetened beverages can decrease the risk of gout flares as well. Research has shown that drinking 1 drink a day didn't significantly increase the chance of gout flares, but drinking more than 1 or 2 drinks a day did. Fatty foods have also been shown to cause gout flares as well. The consumption of cherries and vitamin C has also been shown to decrease gout flares as well. Interestingly enough, avoiding foods with a lot of purines in it is no longer recommended because studies have shown that it does not decrease the number of future gout flares. Talking to your doctor about some of the medications that you take can also help decrease the risk of gout flares.
I didn't know about the cherries. That's
Yeah.
kind of new to me. So you made this wonderful slide, and it was in the shape of a traffic light. So let's, maybe if somebody could take away one thing,
Sure.
maybe this could be a good takeaway. So what foods that we want people to be aware of when they go forward with the thought of gout in mind?
Sure. So the picture of the stoplight is to help people know what foods are okay to eat for gout and what foods should be avoided. People at home can turn their attention to the picture that is on the screen. Next to the red light, you can see a picture of greasy foods, soda, and fruit juice. Stopping the consumption of fatty foods, sodas, and fruit juices with a lot of sugar can help with gout flares. Next to the yellow light, you can see a picture of alcohol, meat, as well as seafood, which are foods that you can continue eating with caution. Reducing the amount of alcohol you consume and limiting the amount of meat and seafood can help reduce the risk of gout flares. Next to the green light, you'll see a picture of citrus fruits, which are known to be high in vitamin C, cherries, as well as a carton of low-fat milk. Consuming foods that are high in vitamin C or even taking a vitamin C supplement can help reduce the risk of gout flares because vitamin C makes it easier for the body to remove the uric acid from the body. Some of the proteins that are found in low-fat dairy have also been shown to help remove the uric acid from the body. I just wanted to emphasize that it's not about completely cutting these foods from your life, but it's more about reducing your intake.
So all of this is really important and I think very, very helpful and factual for our viewers. So a couple of things. First of all, thank you
Thank you
for coming.
Thank you for having me.
My pleasure, and good luck in May when you graduate.
Thank you.
And I think all of this will be extremely useful going forward. So if you or anyone that you know would like more information about Neighborhood PACE, please feel free to call us at any time. Our phone number is 617-568-6377. We would love to hear from you. And then until we meet, please be well. Thank you. Bye now.